Breast cancer can be an aggressive disease and a frequent cause of mortality, especially among women. In recent years, low and middle-income countries have witnessed a surge in cases of metastatic breast cancer, or MBC, reporting high fatality rates. Ideally, patients with MBC need guidance and care from skilled oncologists, prompt diagnosis, and individualized treatment plans. However, resource-constrained regions in most of the world have limited access to highly trained clinicians or diagnostic and treatment options. Additionally, misconceptions can lead patients to believe that costly treatments yield better outcomes. Therefore, it is imperative to define optimal treatment regimens for patients with MBC in resource-constrained settings. To this end, an international multidisciplinary expert panel, including patients, was set up to develop clinical practice guidelines to provide guidance on the systemic treatment of MBC to clinicians, policymakers, and patients in 3 global resource-constrained settings. The expert panel reviewed existing maximal setting guidelines of the American Society of Clinical Oncology, or ASCO, by conducting modified ADAPT and formal consensus processes. 4 published ASCO guidelines were adapted for resource-constrained settings. The guideline was reviewed globally by a large consensus panel, external reviewers, and with public comment. The guidelines received more than 75% agreement, ASCO approved, and published by the Journal of Clinical Oncology, Global Oncology. The recommendations advise clinicians to consider treatment in accordance with the patient's menopausal status, as well as their pathological and biomarker characteristics, provided that high-quality testing results are accessible, as well as the patient's and their family's potential access. The adapted guidelines define first, second, and third-line treatment regimens for patients with various subtypes of MBC. This is especially crucial for the second-line recommendations for patients with HER2-positive MBC, where certain highly specialized novel medications, for example trastuzumab deruxtecan and trastuzumab emtansine, may not be available. This summary highlights the importance of customized guidelines and the dedication of the expert panel to improving quality, equitable patient care globally.